Hey guys, it's Dr. Andrew C here. For the last 2 decades, the biggest pain point for me with implants in the aesthetic zone has been trying to maintain the buccal bone and buccal contour. If you lose the buccal bone, then it can become unaesthetic because you can see a concavity or large divot in the buccal bone. This is not good in a high smile line case. Biology tells us that if you remove a tooth in the aesthetic zone, that the buccal bone will collapse even with an immediate implant placement after extraction. After several years of utilizing the socket shield technique, first documented by Herzl and Zur in 2010, I believe that this is currently the most optimal technique to maintain the aesthetics with implants in the aesthetic zone. Now, what is the socket shield technique? The socket shield technique allows us to keep a portion of the root structure intact. This helps us preserve the surrounding bone and soft tissue. This is the key factor for achieving a harmonious soft tissue outcome. This technique can make all the difference in the aesthetic zone, especially when preserving the natural contour and avoiding bone loss and subsequent soft tissue loss post-extraction. In this video, you'll see a case where I used the socket shield technique to replace the upper right lateral incisor. The patient had a compromised 1-2. It had previously been crowned many years ago and the tooth broke off right at the gingival level. Here, we have a very critical decision to make: extract or salvage. After careful assessment and treatment planning, we decided that the best course of action was to do a bit of both. Essentially, I removed part of the tooth and left part of the tooth in place. I then placed an immediate implant behind this portion of the tooth, and then I made a custom healing abutment. The final implant crown will be made after full integration. Now, if you want to go more deeper into my framework for deciding whether to extract a tooth or salvage a tooth in the aesthetic zone, I have a podcast all about this. There's a link in the description. So the first thing that we must do is section the tooth properly. This can often be a little bit more trickier with an upper lateral incisor because it's a really small root and the adjacent teeth are really close by. After I've sectioned the tooth, I then remove the palatal portion to leave the tooth shield behind like you see here. Then we go ahead and place our implant behind the shield. You then can make a provisional implant crown, and depending on the primary stability that you achieve, this may need to be modified to a custom healing abutment like I did here. After 5 to 6 months, it's ready to be restored. You can see a wonderful developed emergence profile which resembles the original situation. This patient is an older patient and has some previous gingival recession present before. If we have a look at the occlusal view, we can see that there is zero bone loss of the buccal bone. There is no concavity present. Why? It's because the body thinks that the tooth is still there, and because of that, it does not eat away our buccal bone. Okay guys, thank you for watching. I hope that you've enjoyed today's video. Please go to dentalmasteryacademy.com.au for more learning resources and upcoming courses as well. If you found this video useful, please give it a like and subscribe to my channel, because my goal is to make you as awesome at dentistry as possible.